We've had a great relationship, as an example, with Governor Cuomo, with Governor Newsom. We've had a great relationship with the state of Washington. Those are three hotbeds. Now, we're also dealing with other states. As the Admiral said yesterday, we're dealing with all of the states, actually, in one form or another. Some are very affected in a very minor way, where you have 2 people or 3 people. And I don't even mean deaths, I mean literally cases. And that's different than New York, where you have, tremendous, where everybody, I lived there for a long time, everybody's extremely close, tight. And you have a lot of cases in New York. And we're helping Governor Cuomo. We're helping Governor Newsom. They've been total gentlemen. They want to get it done, and we want to get it done. But doing it the way we're doing it is much better. It's really much better.
But in terms of I'm asking about the supply chain. It's about allocation, not about manufacturing. So the companies, it's not about nationalizing the companies, it's about the allocation.
We coordinate with the states, and we are coordinated with the states. And for the most part, the coordination's been very good. Look, 3 days ago, I had a phone call with all the governors. I actually allowed the press to stay. They weren't supposed to stay. And one person in the media said, that was surprising. It's actually a little risky doing that, because we had Democrats and we had Republicans. And, they're politicians, and they always have something to say. Well, I took a lot of calls, and we really didn't get one nasty or bad response. They were thanking us for the job we did. And I had the press standing. I don't know if you were there. I don't think so. I had the press standing there watching. They weren't supposed to be there, but I said, let them stand there. The governors were very complimentary. Very, very complimentary. Our relationship with China is a very good relationship. I wish they told us 3 months sooner that this was a problem. We didn't know about it. They knew about it, and they should have told us. We could have saved a lot of lives throughout the world. If you look at what's happening in Italy and Spain and a lot of other countries, we could have saved a lot of lives throughout the world. Kelly?
Mr. President, given the diagnosis for Senator Paul and people being self-quarantined, what concerns do you have about the direct threat to the function of the Senate, the ability to get this important package that people are waiting for passed? And should Americans be expecting you to extend the 15 days, given the climate of how this is spreading at this point?
Well, I hope we won't have to. It's possible, but we'll have to see how that works. As far as the Senate is concerned, we are looking at some of the folks are feeling very good. Some are quarantined, but they're negative. They may be totally fine. Okay. Others are positive. We went again. They didn't respond. If they went in, they would have been able to give us a much earlier indication. But we had an early indication. That's why I closed out China. I mean, I felt it was my instinct, but that's why I closed out China at a very early time. Please.
Mr. President, are undocumented persons welcome at testing sites, and can they show up and be tested without fear of being reported to immigration officials for possible deportation?
It's really a fair question. I think I'll let. Would you like to answer that question? Please,
Absolutely.
Please. Surgeon General.
We know from a public health perspective that it is important that people who have symptoms can get tested. But as you heard earlier, we are
Regardless of citizenship.
well, we know that the virus doesn't judge based on where you're from. And so it's important that we try to get people tested who have symptoms. But the important thing that we really want people to hear is that inpatients need to be tested. We need to prioritize our healthcare workers. And one thing I would like to say to you all very quickly, on behalf of the doctors on the task force, healthcare workers, we hear you. We hear you, and we absolutely are prioritizing your health and safety, making sure healthcare workers can get tested, inpatients can get tested, people at highest risk. But to answer your question, yes, we absolutely want to make sure people who have symptoms who could be spreading it can get tested.
Without fear.
Question. Surgeon General. Department of Homeland Security addressed that issue a few days ago. Customs and Border Protection actually issued guidance that absent certain circumstances, Customs and Border Protection does not target emergency rooms or health clinics. And I would refer you to the website. They issued a very clear statement making it clear to any person that is in need of a test or medical care that Customs and Border Protection is not focusing on emergency rooms or health clinics or the drive-through clinics.
So that they could come in without fear of.
Yes, I'll answer that, and if that's not the policy, I'll make it the policy.
The Vice President gave an important statistic this morning. Only 10% of the people who have symptoms who've been tested actually tested positive for coronavirus, meaning 9 out of 10 people who actually likely had symptoms do not have the coronavirus. So I want people to understand that so that they are reassured. I also want to direct people to a website we've been telling them about all the time, coronavirus.gov. Coronavirus.gov has information to walk you through the symptoms, fever, cough, shortness of breath, body aches, and what to do if you have symptoms or you're worried. The most important thing we can tell people is call your healthcare provider, talk to your healthcare provider. Information is at coronavirus.gov to walk you through when to come in and when and what to do.
Thank you, Mr. President. I was hoping you could give some guidance to American families who are anxious about their financial futures. Earlier today, on one of the Sunday morning shows, the Secretary of the Treasury, Steve Mnuchin, was talking about the millions of Americans who are impacted by these shutdowns that are happening in cities and sometimes full states.
Yeah.
And Secretary Mnuchin said that this shutdown, this lockdown could last 10 to 12 weeks, perhaps early into June. Given that, would you consider another fiscal stimulus, another check to these
We're going to
families?
see what happens. Hopefully we won't need it, but we might. But we're going to see what happens. Look, the greatest thing we can do is win the war. The war is against the virus. That's the war. We do that, everything, I really believe everything's going to fall into place. It's going to be beautiful. I call it a pent-up demand. People are dying to go out to a restaurant. People are dying to go onto airplanes. I think there's a tremendous pent-up demand. You may be surprised to the degree. I think it's going to go very rapidly because this wasn't a financial crisis, just the opposite. This was a medical crisis.
Mr. President,
Go ahead, how about you?
foreign countries, please. I realize that your priority is to Americans and, of course, this nation. But what about, have you ever considered supporting the foreign countries who are also fighting this global pandemic?
Well, we do help foreign countries. I mean, that was the other question.
Right.
And I'm
You're
honored to help.
offering
And the
right.
doctor has helped. The Surgeon General is speaking to other countries all the time. They're asking him questions. What do we do? Nobody's ever seen anything like this. They're calling our people all of the time. And yes, I have let it be known that we'll help people, including North Korea, including Iran, and including many other countries. It's very important to do that.
Your administration is backing a lawsuit to invalidate the Affordable Care Act. Given that people are losing their jobs now and need health care more than ever, would you consider rethinking your position on that?
Well, that's a lawsuit coming out of Texas again. That was headed up by Texas. And what we want to do is get rid of the bad health care and put in a great health care. And we will always, I will say this, I can make this commitment to you, the Republican Party is fully backing pre-existing conditions. Now, if we could get a great health care plan, which would need the House to do, but if we can get a great health care plan, we will only do it if we have pre-existing conditions totally back. So we're backing pre-existing, but would like to get rid of bad health care. Now, we are running the bad health care much better than it was ever run, and we're making it better. But it could be much better than it is. And so what we want to do is terminate it, have a great health care, but we will only do it with pre-existing. We will back pre-existing conditions. Okay?
But what if the Supreme
Thank you all very much. Thank you. We'll be back. We'll have a meeting tomorrow.